Hey guys, welcome back to Mommydom. This is Narissa again, your certified breastfeeding specialist. Today's topic is going to be overcoming difficulties in breastfeeding. Now, today we're not going to talk about every difficulty that's going to come with breastfeeding. There'll be later videos specifically about certain things, but today we're just going to talk about a couple of common things that are majority of the reason why moms don't continue to breastfeed. First, we're going to talk about how to avoid sore nipples. When you have sore nipples, there can be several reasons why, but the main cause can be an improper latch. And an improper latch can be classified as several different things. It could be the way you're holding baby. It could be the way the baby is attached to the breast. There's so many things that can go wrong in the latch that has nothing, that's not your fault. It's not baby's fault. It is just simply something going on in the experience that needs to be corrected. A few ways to help you minimize as many problems as you may experience would be to hold baby tummy to tummy. And that's literally exactly what it says. Baby's going to be on its side, literally touching tummy to tummy with you. Support baby's ear, shoulder, hip alignment. Make sure their airway is open. And the way that you do that is to place your hand on baby's neck. You control the neck, you control the body, and use your forearm to control the back part of their back. And just hold them tight, hold them close to you. They've been close to you for the past 9 months. Also, mommies, if you have bigger breasts, support your breasts. You can put your hand in the C shape, use your 4 fingers, and place them under your breast to hold your breast up. And use your thumb at the top of your breast. Put it as far back from the areola as possible so you can fit as much areola as possible in baby's mouth. You can also use pillows to hold baby up like a boppy would or a my breast friend would. You can use rolled up towels, rolled up receiving blankets. You can have a footstool to kick your feet up and get comfortable. Whatever is necessary for you to get comfortable, make it happen. The biggest thing with breastfeeding is you being comfortable. Nobody wants to sit in a position that is extremely uncomfortable for hours on end, because you will be sitting for hours on end. Possibly not in a specific latch session or a specific pump session, but if you average your time out, you're going to be sitting more than you're going to be standing, or laying more than you're going to be standing. Sore nipples, when you get ready to latch, you can align your nipple with the baby's nose. That way, baby can smell your breast. And once baby smells your breast, baby will drop its head back and open that mouth wide. And all you have to do is guide baby's head. Just control the neck. That's all you need to control. As soon as your baby opens their mouth wide and drop that head back, latch baby. That way you can get as much breast tissue in the mouth as possible. These are the makings of a good latch. If baby has the duck lips, where the top lip is flanged outward, bottom lip is flanged outward, meaning you can see the little inside part of their lips, they have a good suction. You should also be able to hear baby swallowing. You'll hear sound. That's baby swallowing. Baby will suckle really fast at first. That's just stimulating your letdown. And then baby will start the long suckles, and that's when you'll really be able to hear that k k sound. Breastfeeding is typically painless. It's not supposed to be painful. There is a little discomfort in the beginning because your nipples have never done this job before, and baby is still getting the hang of it. Just because breastfeeding is natural doesn't mean it's easy. It's another job, just like being a mom is another job. If you are having any problems, please reach out to your local lactation consultant or your local peer counselors. Peer counselors are usually in WIC. Your hospitals will have lactation consultants. You'll have nurses that are lactation consultants. You will have private practice lactation consultants. There are people out here that can help you. Next, we're going to talk about how to avoid engorgement. Engorgement is the fullness of your breast. For moms who have had it, including myself, we describe it as your breast feeling like cement bricks on your body, like on your chest, like you can't breathe. It wakes you up. Typically, that's because you've missed a feeding and you need to get that milk out. The best ways to avoid engorgement is to get the milk out as often as possible. Feed baby as soon as baby shows hunger cues. That's the best way to do it. Possible causes for engorgement will be supplementation. Now, supplementation simply means in addition to. When we think of supplementation, we think of formula, but it's simply in addition to. So you can supplement with breast milk. If you have stored pumped breast milk, you can supplement with that. A lot of NICU moms do supplement with breast milk. You can get donor milk. Supplement with that. It's all in addition to. Infrequent feedings, which means you've skipped a feeding. Going long periods of time without feeding, that's again a skipped feeding. You're telling your body you don't need that milk. Each time you skip a feeding, you tell your body you don't need that milk. Limiting baby's time at the breast, like watching the clock instead of watching the baby, that can hurt your milk supply if you are not getting all that milk out. Again, you're telling your body you don't need that milk, which means your body does not produce as much milk the next time. Ineffective emptying of the breast. Some babies do struggle with this. And your local lactation staff, your pediatrician, especially one that is very knowledgeable in breastfeeding, can help you resolve this problem. Remember, in breastfeeding, there are a lot of speed bumps and detours. There are hardly any roadblocks completely. There's always a way to get your problem solved. You just need a little bit of help. Just ask for help. Alternating breasts in a single feeding when the baby does not indicate that it's time for that. So that's like saying I put the baby to each breast for 5 minutes a piece, and that's all they get. I just keep swapping back and forth. When your baby is done with that breast, your baby will push off. Your baby will unlatch. Your baby will go nodding off, which we call a breast milk coma. If that happens and they're not fussy, you can always offer the other breast, but if they don't take it, that's perfectly fine. Typically, a full feeding is both breasts, but early stages of breastfeeding, some babies don't take both. It may take them a little while to get to that point. How to avoid engorgement. Frequent feedings at the breasts. So Most times you'll hear every 2 to 3 hours. When I counsel moms, I like to say 12 or more in 24. That does break down to every 2 to 3 hours. However, I don't want you watching the clock. It's very important to watch baby. So you just need to make sure your baby has 12 or more feedings in a 24-hour period. If you want to put little rubber bands on your arms like you would with your water, that's perfectly fine. You will know if your baby has 12 or more feedings because it'll feel like you're always feeding. Avoid supplementation if possible. Sometimes it's not possible. In breastfeeding, sometimes you have to supplement. Breastfeeding is not a perfect art. Things happen. Supplementing is okay. Remember, I said supplementing is simply in addition to. It does not always mean formula. Make sure that baby is latched appropriately to the breast. Go to your local WIC office and have a peer counselor do a latch assessment for you. Go to your local lactation staff at the hospital and private practice and have them do latch assessments. That way you know that baby is effectively emptying the breast. Allow the baby to completely finish at the breast. Allow them to push off. Allow them to nod off. These are things that they are supposed to do to show you that they are done eating. Don't force them to finish anything. Treatment for engorgement. You can use a warm cloth and place it on your breast, like a warm compress, a warm shower, warm heating pad. Warmth will help that milk come down. A lot of moms like to put warm water in a basin and just place their breast in the basin. You'll see the milk flow out. Some moms will actually hop in the shower and you'll see the milk flow out. I like to teach moms hand expression so they can be doing that as well to effectively get the milk out. You want to do this simply for relief. Do not pump that milk out. If you do it simply for relief. Remember, the more you take out, the more you produce. You want to just feel relief. Cold treatments can be used to relieve pain and swelling, like ice packs, the little gel packs that they now sell, frozen vegetables, anything that will help you relieve that pain and swelling. Now, cabbage leaves can be used. Fresh cabbage leaves at room temperature or frozen, not canned and not cooked cabbage. Fresh cabbage at room temperature or frozen will do the trick for you. Now, to further tell you about cabbage, it can dry your milk up. So just be mindful of that when you're using it. Again, pumping and hand expression works, but again, for relief only. And make sure that the areola is softened sufficiently to allow baby to latch on correctly to avoid pain to the nipple. If you have engorgement, your breasts are like basketballs. You cannot latch onto a basketball in any way, shape, or form. You need your breast to be soft. And the areola is the dark part of your nipple, around your nipple. Just to think of. How to make lots of milk. I get this question so much. Every mom wants to know, what can I do to build my supply? Well, it's all about the autocrines and endocrines. They drive milk production. Again, good latching will do the trick each time. Having baby breastfeed 12 or more in 24 hours will get what you need done. And it's all about supply and demand. What you take out is what you will produce. I know that there are a lot of products on the market that says that they will help you increase your supply. Breastfeeding is all about what you take out. You can eat those cookies, drink the teas all day long, but if you're not getting that milk out, your production is not going to go up. That's something that you should always, always remember. If you need help, ask for it. They have La Leche Leagues. You can find one close to you. Community resources would be your local WIC office, hospital lactation. There is help if you need it. Remember to avoid sore nipples. Good latching helps every time. To avoid engorgement, frequent feedings. And to make more milk, remember, what you take out is what you produce. You guys have a good night. Until next time.